Video sponsored by EduQuest. EduQuest offers skill-based courses in digital marketing, stock market, coding, and more.
The struggle to find courses that truly speak your language, it's finally over. Welcome to EduQuest, where learning is made just for you. At EduQuest, we bring you a wide range of online courses, from career building programs to skill boosting masterclasses, all in your regional language. Because we believe language should never be a barrier to success. Our courses are tailor made after understanding what today's learners really need. So why wait? Start learning the smarter, simpler way only with EduQuest. Visit eduquest.courses and explore your next course today. And hey, don't miss out on our exciting offers and promotions.
Hi guys, if you are in NORCET and other nursing competitive exam preparation, then you can join with me for practicing previous year MCQs. Let's start this video. First question is, which of the following diagnostic test is considered as a gold standard for confirmation of HIV infection? Options are option A, ELISA test, option B, TRIDOT test, option C, Western blot test, option C, polymerase chain reaction PCR test. In this question, correct answer is option C, Western blot test. Next question, which of the following is an indicator of AIDS? Options are option A, CD4 count lower than 100 cells per mm cube, option B, CD4 count lower than 600 cells per mm cube, option C, CD4 count lower than 400 cells per mm cube, option D, CD4 count less than 200 cells per mm cube. In this question, correct answer is option D, CD4 count less than 200 cells per mm cube is considered as an AIDS. Next question, the clinical symptom of wasting syndrome in AIDS include. Options are option A, involuntary weight loss, option B, chronic diarrhea, option C, protein energy malnutrition, option D, esophageal candidiasis. Options are option A, ABC, option B, BCD, option C, ABD, option D, ABCD. In this question, correct answer is option A, ABCD. Involuntary weight loss, chronic diarrhea, protein energy malnutrition. The symptom of wasting syndrome in AIDS include involuntary weight loss, diarrhea for at least a month, protein energy malnutrition, extreme weakness and fever that's not related to infection. Esophageal candidiasis is an opportunistic infection of AIDS patients. Next question, which is the most common cancer associated with AIDS? Options are option A, leukemia, option B, adenocarcinoma, option C, osteosarcoma, option D, Kaposi sarcoma. In this question, correct answer is option D, Kaposi sarcoma. Kaposi sarcoma is one of the first conditions recognized as an opportunistic infection for HIV patients. It is most common related to AIDS associated neoplasm. Non-Hodgkin lymphoma is the second most common AIDS-related cancer. Next question, which of the following antiretroviral drug is newly introduced by NACO for the treatment of HIV positive patients? Options are option A, tenofovir disoproxil fumarate, option B, lopinavir, option C, lamivudine, option D, dolutegravir. In this question, correct answer is option D, dolutegravir is the first line treatment for all age group of populations. Thank you for watching this video.